everybody, welcome to Pharmacy Times. Today we'll be looking at a plant-derived wonder drug, aspirin. It is a carboxylic acid and its IUPAC name is 2-acetoxy-benzoic acid. However, behind the simple structure of aspirin is a story that changed medicine forever. Four thousand years ago, the ancient Sumerians made a surprising discovery. If they scraped the bark of a particular kind of tree and ate it, their pain disappeared. Little did they know that what they had found was destined to influence the future course of medicine. What the Sumerians had discovered was a precursor to the medicine known today as aspirin. Aspirin's active ingredient is found commonly in willow trees and other wild plants, which is how it came to influence the medical traditions of Sumer, ancient Egypt, ancient Greece, and other cultures. Around 400 BC, Hippocrates, thought as the father of modern medicine, first recommended chewing willow bark for pain relief and making willow leaf tea to ease the pain of childbirth. But it took 2,000 years for us to comprehensively investigate its potential. In the late 18th century, an Englishman named Edward Stone ran 5 years of experiments showing that willow bark crushed into powder and eaten could cure a fever. It took another 35 years for a French researcher to finally identify and purify the substance that made all this possible, a yellowish crystal compound that was named salicin a couple of years later. By then, doctors were routinely using willow bark and other salicin-enriched plants such as the herb meadowsweet to ease the pain, fever, and inflammation. But things start to change. For a long time, a lot of chemists saw substance from living beings had some vital force that made them different from non-living things, an idea known as vitalism. But in 1828, a German chemist named Friedrich Wöhler showed otherwise when he synthesized urea, a substance found in sweat and urine. This was the first time that someone made an organic compound from inorganic materials in the lab. Scientists began to realize that living things are now so chemically different from non-living things. This event swung the door wide open for experimentation into organic chemistry, the study of compounds usually found in living things. So for drugs like aspirin, huge processes are being made in the next few years. In 1838, an Italian scientist named Raffaele Piria synthesized a stronger form of active ingredient in willow bark for the first time, salicylic acid. This marked an enormous shift in the approach to drug development. Researchers were not purifying what they found in nature anymore. They were actively working to change the chemical structure of compounds to develop more effective treatment. Then, in 1897, the pharmaceutical company Bayer found a new method and began marketing the compound as a pain reliever called aspirin. The new method involved a reaction known as acetylation. It replaces one of salicylic acid's hydroxyl group with an acetyl group which has two carbons, one double bonded to an oxygen and the other bonded to three hydrogens. The result was acetylsalicylic acid, the modern active ingredient in aspirin. As a result, aspirin was widely recognized as one of the first synthetic pharmaceutical drugs. Yet, despite aspirin's medical value, at this point, scientists still didn't actually know how it worked. In the 1960s and 70s, Swedish and British scientists changed that. They show that the drug interrupts the production of certain chemicals called prostaglandins, which controls the transmission of pain sensations and inflammation. In 1982, their discovery won the researchers a Nobel Prize in Medicine. Over time, research has also uncovered aspirin's risk. Overconsumption can cause bleeding in intestines and brain. It can also trigger Rett syndrome, a rare but fatal illness that affects the brain and liver in children with an infection. And in the late 20th century, aspirin's success had been overshadowed by newer painkillers with fewer side effects, like acetaminophen and ibuprofen. But in the 1980s, further discoveries about aspirin's benefits revived interest in it. In fact, the 1982 Nobel Prize winners also demonstrated that aspirin slows the production of thromboxanes, chemicals that cause clumping of platelets, which in turn form blood clots. A landmark clinical trial showed that aspirin reduced heart attack risk by 44% in participants who took the drug. Today, we prescribe it to people at risk of heart attack or stroke because it cuts the likelihood of clots forming in the arteries that supply the brain and heart. Even more intriguingly, there is a growing body of research that suggests aspirin reduces the risk of getting and dying from cancer, especially colorectal cancer. This might be due to aspirin's antiplatelet effects. By reducing platelet activity, aspirin may decrease the levels of a certain protein that helps cancer cells spread. This discovery has transformed aspirin from a mere pain reliever to potentially a life-saving treatment. Today, we invite Dr. Chen from Harvard Medical School to share his studies on aspirin. Hi, Dr. Chen.
Hi, I'm Andrew Chan. I'm an associate professor of medicine at Harvard Medical School, and I'm a gastroenterologist at Massachusetts General Hospital. Much is known about the effect of aspirin in the prevention of heart disease, and also emerging data has really shown that aspirin can prevent colorectal cancer. But much less is known about the effect of aspirin on other cancer types, and that's an important question given the potential ramifications that aspirin might have on our overall public health. We did this study because recently the U.S. Preventative Services Task Force recommended that aspirin be considered for prevention of both colorectal cancer and heart disease in certain individuals. So we wanted to understand what would be the potential impact of a large population taking aspirin on a regular basis.
Thank you very much for sharing your insights, Dr. Chen. Aspirin has two structural isomers, 3-acetoxybenzoic acid and 4-acetoxybenzoic acid. Scientists are still trying to determine the different structure-activity relationships. Today, we consume about 100 billion aspirin tablets each year, and researchers continue searching for new applications. Already, aspirin's versatility has transformed modern medicine, which is astounding, considering its humble beginning in a scraping of willow bark. And that's all for today's Pharmacy Times. Thank you everyone for listening.